Examination and Treatment of Achilles Tendonitis and Tendinosis by Brad Dwong and Aaron Oliver. So what is Achilles tendonitis? Simply defined, tendonitis is the inflammation of a tendon. Inflammation is the body's natural response to injury or disease and often causes swelling, pain, or irritation. There are two types of Achilles tendonitis based upon which part of the tendon is inflamed. There is non-insertional Achilles tendonitis, which is where the fibers in the middle portion of the tendon have begun to degenerate, swell, and start to thicken. And then there is insertional Achilles tendonitis, and this type involves the lower portion of the heel, where the tendon inserts into the calcaneus. So when you are beginning an examination on a patient who has Achilles tendonitis, we first want to inspect the limb for any obvious deformities, swelling, or bruising. We then want to inspect the posture of the foot and ankle and follow with manual muscle tests of the anterior and posterior muscles. It is important to check the range of motion at the knee and especially the ankle to see if there are any deficits. And lastly, we want to palpate the Achilles tendon itself and its surrounding soft tissues to feel if there are any abnormalities or any sort of pain. So, some symptoms of Achilles tendonitis may include pain and stiffness along the Achilles tendon in the morning, and as well as pain that worsens with activity, severe pain the day after exercising, a noticeable thickening of the Achilles tendon. You might even see a bone spur, which is common with insertional tendonitis, and there may be swelling that is present all the time and worsens throughout the day, especially after exercise. As we can see, Achilles tendonitis is a fairly common overuse injury that you will see in an array of athletes, but it is more common in older athletes. It affects a mean age of 30 to 50 years old, and it is 3 times more likely to occur in men versus women. If we're looking at tendonitis versus tendinosis, we see that tendonitis is more of an acute condition or injury that is mainly due to irritation and inflammation and can last up to 2 weeks. Whereas tendinosis is a chronic issue. Increased overuse is what leads to the degenerative effects of the Achilles tendon and requires proper rehabilitation. Otherwise, if left untreated, it can lead to an Achilles tendon rupture. Here's a video of Kobe Bryant's Achilles tendon rupture. This shows his mechanism of injury in an animation, and it's pretty cool to watch. Unsure if this was his condition before, but Achilles tendinosis, if left untreated, can lead to an Achilles tendon rupture of this sort.
There are multiple causes of tendonitis and tendinosis, some of which include improper warm-up, increase in exercise intensity, whether it be due to high mileage or generating a large amount of force in a short amount of time, inflexibility of either the gastrocnemius or the soleus or a combination of both, trauma from running on hard surfaces or hill running, muscle imbalance due to weak anterior muscles, improper footwear, and excessive pronation. Imaging such as x-rays and MRIs may need to be done if the athletic trainer feels a patient is not progressing during rehab, or if we refer to a doctor and they feel it needs to be done. They will either order an x-ray, which will allow them to see if there is any calcification near the point of insertion or hardening of the tendon. An MRI is more important for the use of planning a surgery, but can also detect how severe the damage is to the tendon. Here are some ways to treat tendonitis and tendinosis. With any injury, rest, ice, compression, and elevation should come first. Other ways include soft tissue mobilization around the Achilles tendon, stretching matched with strengthening exercises, a heel cup to take tension off the Achilles, laser therapy, ultrasound, iontophoresis, a non-steroidal anti-inflammatory, corticosteroids, or modifying their activity. So if it's a runner who sustained the injury, having him or her work out on the exercise bike will allow the tendon to rest. And lastly, splinting or orthotics. Physical therapy is a treatment method used to treat more chronic issues of the tendon, some of which include massage to break up scar tissue along the tendon, use of therapeutic modalities such as ice and ultrasound, stretching the gastroc and soleus muscles to increase flexibility, and eccentric exercises including double and single heel drops. The last option is, of course, surgery. The picture below shows progression for double and single leg eccentric heel drops. The beginning movement should always involve both limbs. To perform this exercise, the uninjured leg does a concentric calf raise on the way up, and both calves perform a slow eccentric movement on the way down. To progress this to a single leg movement, again, the uninjured leg performs the concentric portion of the movement. At the top, all the weight is placed on the injured leg to perform the eccentric part of the exercise. The athlete should perform the movement both with the leg straight and bent to work both the gastroc and soleus muscles separately. There have been some benefits linked to using corticosteroids in helping to treat Achilles tendonitis and tendinosis, some of which include providing anti-inflammatory effects and providing some pain relief. The controversy: all evidence of corticosteroids causing Achilles tendon ruptures at this point are anecdotal. Many studies show that patients who received a steroid injection to treat Achilles tendonitis cause a rupture shortly after. Athletes should be cautioned with using corticosteroids, especially when returning to activities. Because of the pain relief that it provides, it can cause athletes to think they can play at a higher intensity than what is safe.